Ladies and gentlemen, please welcome the arrival of their Excellencies, the Governor-General of the Commonwealth of Australia and Mrs Linda Hurley.
Can't make it any bigger.
Well, welcome everyone to this important event today to launch our new Parliamentary Friends of Pain Management Group.
Thank you.
And to also welcome our newest pain champion, Tara Moss, and we're delighted to have her on board. I'd like to begin by acknowledging the Honourable people, the people who own the land on which we're meeting today, and to pay my respects to their elders, past, present and emerging. We're delighted again to be hosted at Government House by the Governor-General, His Excellency, the Honourable David Hurley and Mrs Linda Hurley. Unfortunately, our chairman, Professor Ian Chubb, couldn't be with us today, but he's expressed his gratitude to you both for supporting the work that Painaustralia does and the advocating for the millions of Australians who live with chronic pain. I'd like to acknowledge the co-chairs of our new Parliamentary Friends of Pain Management Group, Senator Wendy Askew and David Smith, the member for Bean. Thank you for your commitment and for helping to establish the Parliamentary Friends Group for us. We know that it's wonderful to have so many parliamentarians being prepared to sign up to support the cause, and we really we value your support. A special acknowledgement also to Tara Moss. We know it takes courage to put your hand up to talk about pain, but we're delighted that you're prepared to support our work and speak on behalf of so many Australians who live with chronic pain every day. I'd like to also acknowledge the Painaustralia board who are online with us today and some here in the room, and Pete Rutland, one of our pain champions, who's also here on Zoom. So thank you, Your Excellency.
So, ladies and gentlemen, a very warm welcome, even though it's a damp day here in Spring Day in Canberra, to a very special occasion for us, for Linda and I, and for Painaustralia. And I begin with joining with Carol in acknowledging that Government House at Yarralumla stands on the land of the Honourable people. I thank them very much for the way they've looked after this beautiful part of our country for generation after generation, and pay respects to our elders past and present. Could I acknowledge Ms Carol Burnett, the CEO of Painaustralia, Senator Wendy Askew, Senator for Tasmania, as the co-chair of the Parliamentary Friends of the Pain Management Group, Mr David Smith, the federal member for Bean in the ACT, also co-chair of the group. Other members of Parliament have joined us, to the directors, champions and others that have joined us today, and to Graham Killer. Graham, welcome back in a virtual sense to Government House. Good to have you here again. Welcome all to this virtual launch of the Parliamentary Friends of the Pain Management Group, which is a non-partisan group open to all senators and members. Welcome also in particular to Tara Moss, the new Painaustralia Pain Champion, and we'll hear from Tara shortly, but thank you for joining us. And as I've said, Linda and I are delighted to participate in this event and help to shine a light on the issue of pain, chronic pain management in Australia. Arthritis, osteoarthritis, osteoporosis, migraine, back pain, neck pain, sciatica, cancer, the list of causes of chronic pain goes on. Right now, 3.4 million Australians are living with chronic pain. It's debilitating for these people, and for a whole host of reasons are well known. Carers, families and friends, of course, are also adversely impacted by chronic pain, as are our medical centres, our hospitals, workplaces, and indeed our economy. Now, the impacts of pain and in our country run deep and wide. And unfortunately, the number of Australians living with chronic pain is on the rise. By 2050, it is estimated that 5.2 million Australians will be experiencing chronic pain. The total cost of chronic pain to the Australian economy this year alone is estimated to be $144 billion. And we have been talking about big figures lately in the economy. That is large and ranks with what we're spending to get us through the COVID pandemic at the moment. Our capacity to reduce the burden of chronic pain is being challenged. Of course, more and more people are experiencing chronic pain. Resources, including money, is tight, and the COVID pandemic has indeed made it difficult for people living with chronic pain. Some haven't been able to exercise, and this can have psychosocial effects as well as exacerbate chronic pain. And waiting times to see pain specialists have increased to 12 months in some public clinics. Then there is a degree of uncertainty, I think, out in the community about what comes in the future. So the time is well and truly right now to do something about it, and that's why you are here, and that's why the new parliamentary group has been formed. Now, by nature, I'm an optimist. I have met and discussed and talked with Professor Michelle Simmons, who's a quantum physicist and a former Australian of the Year. Michelle migrated from the United Kingdom to do her work on quantum physics and to build our first quantum computer here in Australia. And when I asked her why did she do that, a simple statement was because Australians take on and solve the big problems. That brought her here. She's recognised something in our character. And as members of Parliament and as members of a national peak body, you have the same ability. You have influence. You can help solve this big problem through your role as advocates and workers in the field. So I congratulate the group, Senator and David, on the release of the updated National Pain Service Directory in August, and I congratulate Painaustralia for developing a national strategic action plan for pain management. And that directory lists more than 200 public and private facilities, provides mapping and navigation information, as well as listing the various services provided at each facility. And what a wonderful resource that must be for both consumers and health professionals. So thank you again for the work you're doing for your fellow Australians, to improve the quality of life for people living with chronic pain, to ease the burden on carers, families and friends, and to ensure the system for people experiencing chronic pain better meets their needs. The parliamentary group in particular to advocate on behalf of those who need help and to give them, most importantly, hope. With that comment, it's now my great pleasure to launch the Parliamentary Friends of Pain Management Group. Congratulations and best wishes. Thank you.
Well, thank you, Your Excellency, and thank you to you and Mrs Hurley for hosting us here today. It is indeed a privilege that the launch of the Parliamentary Friends of Pain Management Group has been recognised in this way. Thank you very much for doing so today. I would also like to acknowledge my parliamentary colleagues and particularly my co-chair, Mr Dave Smith, MP, Painaustralia CEO, Carol Bennett, staff members and board members who have joined us, and a special welcome to our newest pain champion, Tara Moss, and distinguished guests. Parliamentary Friends of Pain Management Group has been formed over recent months with a key aim of raising the awareness of chronic pain and the management of that pain with our peers within Parliament House and within our community. As you know, chronic pain is pain that continues for more than 3 months after surgery and injury as a result of disease or possibly from another cause. It can be a symptom of a disease or injury, it may occur without a clear reason, and it can be a disease in its own right. When approached by Carol to assist set up a Parliamentary Friends group, I had no hesitation in accepting. I lost my mother last year after watching her deteriorate over many years as a result of the side effects of diabetes. A very practical person, Mum didn't complain about much. She researched and understood each of the complications she experienced, whether that be the kidney failure, the eye damage, the heart damage, or the lack of circulation in her legs and feet. She was aware of what was happening and she accepted it. But like so many others in that situation, it was when she experienced the consistent chronic pain as a result of these complications that Mum was most impacted. And along with nearly 3.4 million other Australians living with chronic pain, Mum's activities became restricted. Over time, we watched Mum's world shrink around her as each step became harder. And it is anticipated that as His Excellency said, that more than 5 million Australians will be living with chronic pain by 2050. That is why we need to act now to ensure access to the correct services and support for the management of pain into the future. As His Excellency mentioned, one of the first activities of the Parliamentary Friends of Pain Management Group was the launch of the updated National Pain Services Directory in August. The directory provides information on services offered by more than 200 facilities throughout Australia. A great first step. Today, we take another step on our journey, and I'm extremely pleased and excited that we are welcoming Tara Moss as the pain champion here at our launch. Tara's reputation as a best-selling author is evidence of her ability to tell a story, and it is her story of strength that will add great value to this role. Tara's adventures with her walking stick, as shared on Instagram, just demonstrates the positive approach she takes in life, and I look forward to many more adventures in months and years ahead as she continues to be destigmatised and mobility aid use in this way. I thank Tara for her willingness and enthusiasm to accept the role as a pain champion and look forward to sharing advocacy for pain management with her in the future. Thank you very much.
David Smith.
Thanks, Carol. I'd also like to acknowledge that we meet on the land of our First Nations people, the Ngunnawal Ngambri people, and it's been their home for thousands of years. I'd also like to acknowledge the amazingly eminent audience we have here in person and also online. The Governor-General, His Excellency General, the Honourable David Hurley, and Her Excellency Mrs. Linda Hurley, our Painaustralia Chairman, Professor Ian Chubb, the patron of Painaustralia, Sir Angus Houston, Painaustralia champions Tara Moss, Peter Rutland, who are with us on Zoom today, federal parliamentary colleagues who have already joined the Friends of Pain Management. I can see my colleague Michael Freelander there, the CEO Painaustralia of Painaustralia, Carol Bennett, and the staff of Painaustralia who've done such amazing work, particularly with the challenges that we've faced across the pandemic. Distinguished guests, ladies and gentlemen, it's a privilege to be here today as the co-chair of the Parliamentary Friends of the Pain Management Group and to welcome the legendary author and journalist Tara Moss, who's the newest pain champion for Painaustralia. Tara, I should let you know that many of my colleagues, if it wasn't the whip being onto them and saying that they had to attend Parliament at midday today, they would be here in person. But Tara is just one of many. She's in excellent company alongside an outstanding group of pain champions, including veteran and Invictus Games competitor Peter Rutland, 7-time Paralympian and New South Wales MP Liesl Tesh, AM, and ABC medical reporter Sophie. And not forgetting the eminent Australians who have taken on such roles with Painaustralia in Professor Ian Chubb and the patron Sir Angus Houston. This parliamentary friendship group has been established to help raise awareness of the challenges by over 3.37 million Australians that live with chronic pain. And we have the capacity to be a real catalyst in bringing together experts, practitioners, as well as people who've suffered the challenges of pain management, in many cases, over decades. The support and advocacy of a group with such amazing champions will go a long way in helping to raise the awareness, the impact that chronic pain can have to ourselves, our loved ones, and our community. In this time of unprecedented health challenges, many people living with pain are not accessing the services they need to manage their pain. It's a particular challenge. It's now more important than ever that pain management is recognised, and prioritising pain as a national health priority will benefit not only our health system, but will reduce lost productivity and other financial costs and can make a real impact on people's mental health and quality of life. I call on the government to commit wholeheartedly to the National Strategic Plan for Pain Management. And I commend Painaustralia, led by CEO Carol Bennett, who continues to drive this important work. I would also like to thank Senator Wendy Askew for her support in establishing this important group and her long-term commitment to these issues. And finally, a very important thank you to our host today, Governor-General, His Excellency General, the Honourable David Hurley, and Her Excellency Mrs. Linda Hurley, who provide their residence and acknowledge their support for this important cause today.
Thank you for that, Nick and Senator Askew as well. We're really looking forward to working with you, and I think it's a wonderful opportunity for us to take this issue forward. I'd just like to give Tara Moss, our new pain champion, an opportunity to say a few words. Thank you, Tara. Mute.
Thank you so much. And thank you for that wonderful welcome. Governor-General, His Excellency, the Honourable David Hurley and Mrs. Linda Hurley, Painaustralia Chairman, Professor Ian Chubb, Painaustralia champions, patrons, CEO Carol Bennett, co-chairs and Federal Parliamentary Group. This is such an honour. Thank you. I'm coming to you all the way from Canada, so I hope that you can feel me with you in spirit, and I wish I could be standing with you today. Pain is an invisible condition, and this is a condition that affects 3.37 million Australians. Just because you can't see it doesn't mean it isn't there. But building a better understanding of pain to address issues of discrimination, misunderstanding, and stigmatization in the community is essential if we're to reduce the sometimes severe impact on those living with pain, their families, and carers. People living in pain already face a multitude of complex barriers and unique challenges. The pandemic and correlated challenges in accessing primary and preventative health care services have had a major effect on the chronic pain community, as have recent opioid reforms restricting access to pain-relieving medication. These are tough times for people in chronic pain. These challenges are amplified for some key groups, such as people in rural, regional, and remote areas, Indigenous people, and socioeconomically disadvantaged communities, children, older Australians, people with disabilities, and those with mental illness. So ensuring access to information, support, and best practice multidisciplinary care in the community is the key to improving the way we respond to chronic pain. For health professionals, access to quality pain management education and training, as well as treatment options, including and beyond medication, is important. Investment in research to address gaps in knowledge about chronic pain and improve pain management strategies is another key strategy as outlined in the National Strategic Action Plan for Pain Management, the National Action Plan that's already been mentioned here today. And that's been developed by Painaustralia, because people in pain and their doctors need options. As someone who has lived with chronic pain for the past few years, I am unfortunately quite acutely aware of many of these challenges, and I'm keen to use my voice to make a difference to those whose voice is currently limited in national health discussions, yet so critical to better outcomes. Thank you for this opportunity. I'm wholeheartedly feeling honored and welcomed here today to be able to participate and be another champion for Painaustralia, to be able to speak out on this important issue. And I look forward to working with Painaustralia to advance the discussion of pain. Thank you.
Well, thank you so much, Tara. We're so fortunate to have you join us and join us as one of our pain champions. And no doubt your voice will make a huge difference to the many Australians who don't have a voice very often that live with chronic pain. So thank you so much, and we look forward to working with you. With no further ado, I'd like to thank the Governor-General and Mrs. Hurley for their wonderful hospitality today. Thank everyone for attending. I think we're having a short morning tea break. So thank you so much, and we look forward to working with you to advance the importance of chronic pain in Australia. Thank you.
Don't run away.
Before we go.
Single on yourself.
Sing the new one.
Yes.
Okay. Don't
Over
come
here.
too close.
We can't come to.
This is a song about sunshine, and people who are suffering pain probably don't feel like they have much sunshine kind of time. I don't mean sitting out in the sun, I mean having joy in their lives. And I believe that we can give sunshine to each other as a gift. And all the people in this room are working very hard to help people have a little bit more sunshine in their lives. So thank you for what you do. And I'm sorry that we can't all sing, but anyway, here we go. Bring sunshine every morning, bring sunshine all day long, bring sunshine with a smile, bring sunshine with a song. Sunshine, come along, sunshine all day long, sunshine, a gift we give, with sunshine let's all live. Spread sunshine every morning, spread sunshine every night. With kindness and caring, our world will be all right. Sunshine, come along, sunshine all day long, sunshine, a gift to give, with sunshine let's all live. So thank you for the sunshine you bring. It's lovely.
Beautiful.